Hi there, welcome to Module 9 of First Aid at Work on Demand. In this video we will look at head injuries and spinal injuries. Any blow to the head will likely cause someone to become dazed and confused, with pain at the site of impact. Most of us will have experienced this at some point in our lives, and these symptoms will usually quickly dissipate within a few minutes of rest, and perhaps the application of an ice pack. However, there is always the potential that the casualty develops a specified head injury such as concussion, cerebral compression or skull fracture. Each of these injuries has its own unique symptoms, but in all cases we will take the casualty to hospital or call an ambulance when dealing with head injuries. Now, a concussion is caused by a shaking or a rattling of the brain, accompanied usually by a brief loss of consciousness. The individual will likely be disoriented, along with mild dizziness and a loss of memory of the event. Sit the casualty down or allow them to lie down with the head and shoulders raised, and treat any visible injuries appropriately whilst arranging transport to hospital. If the casualty becomes unresponsive at any point, carry out a primary survey and place the casualty into the recovery position whilst summoning an ambulance. Cerebral compression is a life-threatening emergency where pressure is building up on the brain. This causes the casualty's levels of response to drop rapidly, leading to unconsciousness. There will be evidence of a recent head injury, along with severe headache. The person will appear flushed with a high temperature, whilst their breathing tends to be slow but very noisy. There may also be signs of weakness or paralysis on one side of the face or the body. Again, support the casualty with the head and shoulders raised whilst summoning an ambulance. The final head injury we will look at is a skull fracture. Now, we may have picked up signs of this during our head-to-toe survey by locating depressions within the skull. We may also see blood or a straw-coloured liquid coming from the ears. The casualty may also be experiencing a drop in their levels of responsiveness. In treating a casualty with a skull fracture, we want to support the casualty with the head and shoulders raised, controlling any external bleeding appropriately. If there is blood or straw-coloured liquid coming from the ears, cover them with a sterile dressing. Again, as with all head injuries, we should call 999 or 112 for an ambulance. And another good indicator for signs of a head injury is to look at the eyes. If there is a difference in pupil size, it is always advisable to go to hospital to get checked out. A spinal injury occurs when there is damage to the spinal cord, and this causes temporary or permanent changes in the body's functions. These can often be caused by a fall from a height, poor manual handling practices or trauma to the back. The effects of a spinal injury can vary from pain at the site of injury through numbness and tingling to complete paralysis. The higher up the spine the damage occurs, the greater the loss of function experienced by the casualty will be.
Keep the casualty calm and instruct them not to move. Support the casualty's head whilst patting around the body to immobilize and prevent further injury. Keep the casualty warm and call 999 or 112 for an ambulance.
Thanks for watching, and don't forget to complete the knowledge assignments before moving on to the next module.